In-position application. The XCollar's patented design allows a patient to be immobilized in their position found without unnecessary and dangerous manipulation. U.S. Department of Transportation EMT guidelines state that improperly fitted devices have a potential for injury and that a patient should not be manipulated to the neutral position if it causes increased pain. If increased pain occurs or the rescuer cannot manipulate the patient from their position found, the XCollar can be applied even with significant lateral rotation used on this patient. In order to easily remember the three main steps for the application of the XCollar, we can use the letters S, A, X. Extend the XCollar to its longest setting. Unfold the back support and lock it in place. Encircle the patient with the XCollar, placing the chin support directly under the patient's chin, ensuring that the chin strap is placed below the lower lip. Connect the lateral buckle into its receiver on the left side of the XCollar. Begin with the lateral strap on the side that the patient is rotated toward. When the patient's head is turned toward the right, begin adjusting the right lateral strap and take the slack until obtaining the desired positioning. Continue to hold the chin support in place and tighten the left side lateral strap while using opposing pressure on the XCollar. Next, adjust the chest support downward. There are two methods of extending the adjustable chest support. The first method is to utilize the two blue and yellow push tabs on each side of the XCollar. The chest support will make contact with the clavicle bone on the short side first. Pinch and lock the short side locking button. Continue to slide down the other side of the chest support until it rests firmly on the patient's chest or upper sternum. To secure in place, pinch lock the locking button. The second method is to push down on the lower center portion of the chest support while holding opposing pressure on the upper chin piece. Ensure the chest support rests firmly on the patient's chest or upper sternum. Be sure to secure both locking buttons accordingly. Finally, deploy the X-strap on the short side by pulling it from its holder. Use opposing pressure by holding the same side vertical portion in front of the chest support. Pull firmly on the X-strap and simultaneously weave it between the channel guides under the patient's chin. Connect the X-strap to the corresponding colored Velcro on the opposite side. Repeat the step for the second X-strap. Visually confirm proper fit. The XCollar is now placed on the patient in position found.